Men are dying early. 44% of men are dying prematurely before the age of 75. Hey, my friend, if you are anything like me, you've made it a lifelong practice to continue to improve, to seek personal development, to seek growth in order to perform at your peak. Lately, I have been wondering if perhaps, just maybe, there is a piece that I've been missing. And that is just going back to the basics. This month, the Movember Foundation released The Real Face of Men's Health in 2025. I've been diving into that for the last couple of weeks, and it's really got me thinking about just going back to the basics. So today I want to unpack that report, some of the findings in there, and the things that we can do as men to address some of the things that came up in that report. Welcome back, or welcome to the channel. My name is Mike Cameron, and I talk about living a life of purpose, connection, and resilience for men navigating midlife, leadership, and legacy. I share lessons learned from running 200-mile ultramarathons, building a multi-million-dollar business, and navigating profound personal loss. So if you are ready to stop performing and start becoming, if you're ready to stop living your life according to somebody else's script, and own your story, then this is the right place. Welcome to the community. Today I want to dive into Movember's 2025 Real Face of Men's Health report. There were a few statistics that came up, a few findings that maybe not surprising, but really got me thinking, because the reality is we cannot perform at our peak as men if we don't take care of our physical, mental, and emotional well-being. That is the foundational piece for many of us. We don't make that a priority. And I know I am guilty of that as well. Let's dive in. One of the first things that came up for me in that report was the fact that men are dying early. 44% of men are dying prematurely before the age of 75. 44%, almost half of us are dying sooner than we need to. That should set off some alarm bells. It certainly did for me, because I don't know about you, but I plan to be here well beyond 75. And if we dive a little bit deeper and look at why that is, the leading cause of death in men is heart disease, cancers, accidental deaths, and then number 4 is suicide. Certainly most of those are preventable with early intervention. One of the statistics that really resonated with me, but frankly a little bit concerning, maybe hit a little bit too close to home for me, is that 65% of men waited at least a week to seek medical attention after a symptom presented itself.
Look, you stupid bastard, you've got no arms left. Yes, I have. Look, just a flesh wound.
27% of us waited a month before we sought professional assistance for any ailment, any symptoms that were coming up. And a staggering 9% of us waited 2 years before seeking help. And I don't know about you, but that one landed with me. And it's I don't know. I mean, I'll go out, I'll run 200-mile ultramarathons. I'll spend a year running thousands of kilometers of training to prepare for said ultramarathon. Yet when it comes to going to see my doctor or my dentist, I can't seem to find the time to make that happen. I was out for lunch with a good buddy of mine last week, and we were talking about a few of the little health niggles that both of us were currently experiencing. And both of us were very reluctant to go get them checked out, to go to the doctor. And I brought up this report and was encouraging him to go get checked out. And he said, yeah, but you know, the problem is first I'm gonna have to do a phone appointment, then she'll probably want me to come in, and then I'll have to go get tests. And who knows how long that's going to take. I joked. I said, when was the best time to plant a tree? 20 years ago. When's the second best time to plant a tree? Today. So we may still be having this conversation in a month or 6 months from now if you don't actually go get this thing taken care of and looked at. And it just goes to show how reluctant most of us men are to engage with the healthcare system. This report looks at what is our experience as men in the healthcare system. So I would love to know what your experience is in the healthcare system. Drop a note below and let me know, as a dude, how easy is it to navigate our healthcare system? In this report, 42% of the men surveyed felt like they had experienced bias towards them from their healthcare practitioner because they were a man, and 26% felt a stigma about talking about their health concerns. As you can imagine, the poll indicated the first experience us men have with our healthcare system significantly impacts our future help-seeking behavior. 54% of the men reported facing barriers to effective engagement with their healthcare provider. 27% reported healthcare encounters that felt rushed. 14% felt their healthcare provider overlooked or minimized their concerns. 15% of the men polled felt that their healthcare provider lacked empathy. And 15% of us found difficulty expressing the severity of their concerns. I'm not sure we needed a research report to tell us these things, but it is great to have concrete evidence. One of the quotes from the report, "My GP seemed to diagnose my depression quickly and Googled medication and listed a few I could try, and I felt as though he did not offer much guidance. I always feel rushed when seeing my doctor. I feel like he is rushing and trying to get onto the next patient and feels like it was not very personal." This is a direct quote from one of the participants surveyed, and I suspect it won't come as any surprise to any of you. The report also found that practitioners were not consistently asking those gateway questions to encourage patients to open up and share further. 28% of the men reported that their healthcare practitioner never asked about anything else going on in their life, in their personal or social life, that may impact their health. 21% reported that their healthcare practitioner never asked about anything else other than the specific issue that they'd come to see them about. Too often the barriers preventing men from seeking support, from seeking healthcare, are reduced to just gender stereotypes. Men don't do this, men don't do that, men don't go to the doctor. When in fact the reasons are diverse, complicated, and interconnected. One of the other pieces that really resonated with me was that disconnection was at the core of a lot of these challenges. 27% of men reported high psychological stress. 23% of the men polled reported feeling lonely most or all of the time. And I gotta tell you, I believe that number is higher than that based on the men I have conversations with. One of the challenges with surveys and reports and research like this is we actually have to get men to be honest about what's coming up for them. And we still struggle with that in a big, big way. 40% of the men polled feel they are not connected to their community. Behind the physical symptoms, there's something deeper: disconnection. Disconnection from self, disconnection from others, disconnection from community, disconnection from a sense of purpose. We isolate, we numb out, and we tough it through. But the reality is we were never meant to do life alone. Cultivating those friendships, especially later in life, gets more and more challenging. How do you make friends when you're over 40, over 50? How do you actually go about doing that without it being awkward or weird? Being very intentional about reconnecting with those that have been close to me and staying connected with those I care about. It's one of the reasons I created our Connected Men's Club. We meet every second Wednesday virtually. It's an intentional space for guys to come together and actually practice building those connections with themselves, with each other, and really with the world around them. Because the reality is, where else do we get to practice that emotional connection piece, that mental health connection? If we want to get physically fit, we know we go to the gym. Yet, if we want to get emotionally or mentally fit, we've got nowhere to go. Connected Men is that space. If that's of interest to you, check us out at ConnectedMen.ca. We would love to have you join our community there. So let's talk a little bit about the masculinity trap. What does it mean to be a man? How does that impact our healthcare needs? How does that impact how we show up in the world? We've been raised in a culture that tells us that we need to be the provider, the protector, the performer. But there's no room for fear. There's no room for doubt. There's no room for weakness. There's no room for softness. We've been conditioned to measure our worth by what we do rather than by who we are. And when we can't live up to these unrealistic bullshit expectations that somebody else made up for us, we collapse under the weight of it, and we wonder why. We need to redefine what it means to be strong, because silence isn't strength, it's surrender. So what do we do? What do we do now? Now that the numbers are in, the research is in, we know the facts, what do we do with this? There's a number of different things. I would encourage you to read the report in its entirety, but for me, there's a couple of really basic pieces that we need to start doing that we've been conditioned and told that we shouldn't be doing. The first one is, let's talk about it. Have the conversation. There's no shame in sharing that you're struggling. There's no shame in sharing that you need a little bit of help. We all do. When I share my story, I often have people come up to me afterwards, and they will often preface what they're going to say to me with, I know my struggle is nothing compared to what you went through, but the reality is we don't have to compare struggles. All of our struggles are different. All of our struggles are unique, but we all struggle in some way, shape, or form. And the beautiful thing is we don't have to struggle alone. So let's start talking about it. Number 2, let's start asking for help. When we need help, let's ask for it. We've been taught to be self-reliant. Self-reliance to a point is a great thing. But there is a point where it becomes a problem. When we try and become so self-reliant that we isolate, we look internal. Dr. John Olaf, the author of this report, talks about the 3 I's: injury, internalization, and isolation. Once we get the injury, we look internally to try and solve the problem. And if we can't, that's when we often turn to self-medication, drugs, alcohol. We look internally. And then when we can't solve the problem internally, we start to isolate. And of course, that doesn't solve the problem, that just makes it worse. So asking for help when you need help, that's true strength. That's what it takes to move the needle. And guys, if you've got somebody around you that's struggling, let's try listening without fixing. As guys, we seem to be hardwired to try and fix things, but the reality is, oftentimes when somebody's struggling, it's not fixing that they need. They just need a little empathy. They need somebody to listen. They need somebody to see them, to hear them, and to understand them. And that's it. And that's the beauty. We don't have to have all the answers. All we have to do is show up and care and listen. It's time to reimagine what being a healthy dude looks like. It doesn't mean we need to abandon strength, but it does mean we need to redefine it. It means that we need to expand the definition to include empathy, connection, care, and vulnerability. So, if you want to perform at your peak while maintaining your peace, we need to start doing a better job of taking care of ourselves, of talking about the challenges that we face, asking for help when we need it, and listening to those around us and providing support. All right, my friend, as always, stay curious, stay connected. Let's move the needle, let's change the narrative, and let's create some cultures of connection.